Hey everyone, welcome to my very first YouTube Live. I'm excited to be here. Hopefully, people are filing in and getting the opportunity to come on in and take a seat. I'm excited to have you guys here. This is my very first YouTube Live, so it may seem a little wonky at times. Don't worry about it. We're going to straighten all that out. I plan on being on YouTube Live in the future many times, so it's going to be a lot of fun. What I thought I would do while we're waiting for people to file in, because I know sometimes people may not be able to get in as quickly as they want, I thought I would tell you a little bit more about my background, kind of what's going on with me. And then once we get a group of people in here, we'll knock it out of the park. I also wanted to mention, by the way, that we just passed 100,000 subscribers, which is a huge benchmark. I just have to say thank you to all of you folks out there who are subscribing. This is very motivating for me to produce more videos and get you more information and see if I can help with your sleep. So I really want to say thank you for doing that. If you haven't had the opportunity to subscribe yet, do me a favor, click down there and subscribe. We have 2 videos coming out every week on all kinds of different sleep-related topics. Also, if you want, you can always send an email in and let us know if there's a particular topic that you're interested in, because I'm always excited to answer your questions and educate people more and more about sleep. So with that, what I thought I would do is tell you guys a little bit about the story of how I became a sleep doctor. A lot of people always ask me that. It's usually one of the questions I get when I'm doing my lectures and things of that nature. And it's kind of a weird story, to be honest with you. So I'm a little bit different. Let me back up for a second and explain what type of doctors are sleep doctors, generally speaking. So generally speaking, 95% of sleep doctors are MDs, medical doctors. So these are people who have specialties in either pulmonary medicine, which is lung doctors, neurology, which are brain doctors, ear, nose, and throat, which is pretty self-explanatory, or sometimes even cardiologists and sometimes psychiatrists. And then on the Ph.D. side of things, we have psychologists who have a tendency to be in this field. So there's a whole host of different types of sleep doctors. So a lot of people don't necessarily know one type from another. And so they talk with their general practitioner and they say, hey, I think I have a sleep issue. And most people end up going to a pulmonologist, again, a lung doctor, because they're usually looking for sleep apnea. That's usually what I would say 90% of the diagnoses are that we see in sleep laboratories. But the truth of the matter is there's 88 different sleep disorders, which is kind of amazing that you can do 88 things kind of kooky in your sleep. But we have a lot of different specialties because sleep is really an entire body process. I think it would be difficult to have only one type of doctor be able to get involved in sleep. So let me tell you how I got involved in sleep. It was kind of an unorthodox way. Again, I'm a PhD, not an MD. But what happened for me was I was getting my clinical psychology degree at the University of Georgia. Go Bulldogs. I'm a big Bulldogs fan, just to let you know. And so I was there and I was about to do my residency. So in getting your clinical psychology degree, all of those programs are about 4 years. And then at the end, there's a 1-year residency program where you kind of practice the things that you've been learning for the past 4 years. And I was at the time incredibly interested in sports psychology. University of Georgia, we had an amazing Division I team. The Department of Exercise Physiology and Sports Psychology was huge. It was awesome. It was great working with athletes. And I really wanted to work with the athletes themselves. I wanted to work with them with their psychological issues, but also with their performance issues. I thought that would be a really cool way to take the skill set that I had learned and apply it to a kind of a unique field. Plus, it's kind of cool when you're working with athletes and seeing some of the amazing things that those guys and gals can do. So I was all set. So you apply, and there's several different ones that are out there. So I applied to what I thought was the top program in the country, which, believe it or not, was at the University of Mississippi Medical Center in Jackson, Mississippi. Now, the program looked at eating disorders in athletes, which I thought was a perfect way to combine my interest level. But I'm going to be honest with you, I couldn't get in. This was a program that was really mostly people from Harvard, Princeton, Yale, like really top notch programs for this particular area of study. And to be honest with you, I went to the University of Georgia. I mean, it's a top 20 program, but it wasn't Harvard. And so I was like, well, I still want to go to this program. And I noticed that they actually had a specialized track for sleep. And so I didn't really know what it was. So I decided to look into it. And what I discovered was I fit the mold perfectly. So I had been working my way through graduate school. I had to, I had took student loans and all that kind of good stuff. And I worked in the Department of Electrophysiology. So I'm kind of that wonky guy that likes to take apart things, put them back together. There's usually a few extra pieces, but hopefully it works better. But I like to play around with EEG machines, EKG machines. And so these were the exact same machines that they used in sleep. So when I was doing all my exercise performance and exercise psychology research, I learned how to use all these machines that they use identically for sleep. So here's what I decided to do. I said, I'm going to sell myself as a sleep guy. And as soon as I get there, I'm going to transfer over into that eating disorders and athletes program because that's really where I want to go. So I sold myself as the sleep guy, got into the program. Day one, I raised my hand and they said, yes, Dr. Breus. I said, hey, I wanted to find out how can I transfer inside of this program? And they said, we had a feeling that you were going to try to do this, Dr. Breus. So here's the deal. Your position is funded by a grant, which means you have to do that position if you want to be paid for 6 months. After that 6 months, we have somebody else who comes in for the second half of the grant, and you can do whatever part of the program that you want. So I was like, this doesn't sound so bad. I mean, how tough could it be? It's sleep, right? I do it every night. I mean, I did it a lot in high school. I did it some in college. How tough could this be? And so I ended up going into the sleep laboratory. And by the third day, I absolutely fell in love with clinical sleep medicine. And I knew I was never going to change my track because here's the thing. With traditional psychology, sometimes it can take weeks, months, even years before you see any real treatment gains. With sleep, I help people like that. It's unbelievable sometimes how amazing it is to have some knowledge and be able to see something that many other doctors who hadn't been trained in that area hadn't had a chance to see yet, especially on the side of insomnia, and then be able to help that individual sometimes with literally 24, 48 hours. I mean, here's the thing to remember. When you change your sleep, you change your life. It really is that fundamental. And boy, I got to tell you, when I was able to do that, it was such an amazing. I felt like somebody had kind of like let me in the side door, and all of a sudden I knew how to fix people. It was really important. It was gratifying, and it made me feel great to be able to help so many people in that area. So I ended up doing the full 6-month rotation in sleep as I was required to do. And then I actually ended up, instead of doing sports psych, I got interested in neuropsychological testing, and I did a 6-month rotation in that. So I know a lot about how to give people tests and understand where parts of their brain may or may not be working exactly right. Obviously, I know quite a bit about sleep. And I started my career. I believe it or not, I answered an ad in the American Psychological Association newspaper for a clinical director for a sleep lab that happened to be near where I was from, which is Sandy Springs, Georgia. It's out in Decatur near Emory. And got my first job there with that group, Southeastern Lung Care. Great group to be working with. I was a Ph.D. basically working with all MDs. And so the way that works is they would come in and see the patient and do the physical stuff. Then I would come back in and do the psychological stuff. So depending upon what kind of case it was, I got exposure to all kinds of sleep-related disorders and really found a love within that whole group. Now, I will tell you, one of the unique things about me as a PhD is one of the requirements of my first job was that I needed to take and pass the sleep medicine boards. And when that was given to me as a requirement, I calmly raised my hand and I said, Doc, I'm a PhD, not an MD. That's a medical board. It turns out that for a 1 to 2 year period of time while they were developing the board, they needed people to take the new test. And so they opened it up to nurses, psychologists, DOs, and MDs to be able to have an opportunity to take the test. And so it turns out when I passed, they closed the door the next year. And so I'm one of 168 psychologists in the world who have taken and passed the sleep medicine boards without going to medical school. And so the reason I felt so strongly about doing that was because it gives me such a unique perspective. So I have lots and lots of medical based knowledge, lots and lots of psychology based knowledge. And when I try to attack a problem, specifically insomnia, which is kind of my wheelhouse, I try to do it really looking at it from both ends. Now, the good news there is it turns out that one of the reasons why many of you have subscribed is because of my super popular video of what do you do when you wake up in the middle of the night and how do you get back to sleep, which falls right into that whole idea of understanding the biology and the psychology of insomnia. So what I wanted to do was delve in a little bit deeper on that video. If you haven't seen it yet, you should check it out. We've had almost 3 million views of it. It's been quite phenomenal. I've been really excited to educate that many people about this. But when we look at this, I'll give you some of the basics that we found in the video. So one of the things that is describing to people their core body temperature cycle. So it turns out that sleep follows your core body temperature cycle. So at night, your core body temperature rises, gets to a peak at around 10:30 and then begins to fall. That fall is a signal to your brain to release melatonin. Remember, that's kind of the key that starts the engine for sleep. That's allowing the sleep process to occur. Your core body temperature continues to drop, but at one point in time, if it keeps dropping, you're going to go hypothermic. So you need to go up and start to heat your body up. So one of the things that I tell people all the time is every single human in the universe actually wakes up somewhere between 1 and 3 o'clock in the morning because their core body temperature begins to rise. Here's the thing. Most people don't know this, but you got to be awake for almost 45 seconds before you realize that you're awake. And so most people just turn over and go back to sleep. So the biology of this is a phenomenon that occurs to everyone. The psychology is, what do you do now that you're up and you're trying to get yourself back to sleep? And so in the video, we talk quite a bit about doing breath work and specific breathing techniques. My favorite technique for this is called 4-7-8 breathing. And that's one of the ones that I think works very, very well. But there are other breathing techniques that I think work equally as well. One of them is called box breathing. This is where you breathe in for a count of 4, hold for a count of 4, breathe out for a count of 4, hold for a count of 4. In, hold, out, hold. You do that for about 8 to 10 cycles. Again, the goal here is to lower that heart rate for you, to be able to get you to go back into sleep and be able to start to understand a little bit more about how anxiety is playing a role here. And a lot of people are so busy counting and breathing that they forget what the thoughts were that they were thinking about, and that anxiety has a tendency to go down, which allows them to fall back asleep. I know that we've got quite a few questions. So what I thought I would do is start out and get a hold of some of the questions that you guys have sent me. Don asks, does vitamin B6 help with sleep? Great question. By the way, we have a whole video on vitamins and sleep. So check it out. If you haven't checked it out, do me a favor and subscribe. But one of the things that's pretty cool about this is all of the B vitamins affect sleep in certain different ways. So one of the things we really want to be thoughtful of too is when you take your B vitamins. I don't know about you guys, but if I take a B complex or any type of Bs in the evening time, it makes me very energetic. And it's quite difficult for me to fall asleep. So one of the things that I talk to people about all the time is when to take your vitamins. And so quite easily, I would say that B is one of the ones you would want to take in the morning time, and it does have a very positive effect on sleep. You have to be careful though, because if you take too much B, you can actually have a very significant reaction. So before you go popping pills of B6, do yourself a favor, talk with your doctor to make sure that there isn't any interaction that could occur with any other things that you might be taking, and that it's appropriate for you to take. Personally, I always run deficiency blood profiles on all of my patients before we start adding things like vitamins and minerals. Awesome. So now we've got a question from Marianne, and she said, starting CBT-I therapy next week, had insomnia, early waking since last year. What can I expect? What a great question, Marianne, and thank you for asking it. So CBT-I stands for Cognitive Behavioral Therapy for Insomnia. Now, for folks out there who've been in therapeutic situations before, you may have heard of cognitive behavioral therapy. Cognitive behavioral therapy works based off of a very particular model called the feelings, actions, and thoughts model. And so what we know is our feelings affect our thoughts, and our thoughts affect our actions, and our actions affect our feelings. So we see this tremendous feedback loop that goes on here. And if we have one thought that's kind of off the deep end, it starts to make the washing machine go faster and faster. So a lot of people, when they're thinking about insomnia, are given a questionnaire called the Beliefs and Attitudes About Sleep questionnaire. And it asks them, what do you think about sleep? And a lot of people, unfortunately, have got some misinformation about it. And so the cognitive portion of cognitive behavioral therapy is really looking at all of those pieces of misinformation that you might have. Let me give you an example. One of the things that a lot of people will say to me is, hold on. Hey, Dr. Breus, if I don't get 8 hours of sleep, my next day is going to be ruined, right? And so when you challenge that thought, you're like, well, you've definitely had bad nights of sleep before, right? And they say, yeah. And then you say, your day wasn't completely ruined, right? Like maybe it was a little difficult in the morning. And they say, yeah. So I say, so on a scale of 1 to 10, now that you're really thinking about it, it sounded like it was a 10. It sounds like it's getting a little less emphasis now. And they say, oh yeah, you know what? It is getting less. And that's how we start to slowly change how you think about sleep. The behavioral section of cognitive behavioral therapy is where somebody actually gives you times to go to bed, times to wake up, when to limit caffeine, when to drink alcohol. All of those things get wrapped. And a lot of therapists will do both together. For me personally, I like to start with the behavioral measures because a lot of people feel much more comfortable working with changing their schedule. And to be honest with you, I'd say about half the time when I'm just doing the behavior stuff, it fixes the problem right away. That doesn't mean that we should leave the cognitions alone, especially if somebody's got some thoughts or things about sleep that aren't necessarily true. We always want to address those. But at the end of the day, the behavioral seems to have a big effect. And then the cognitive is what seems to keep you in that whole mode. So that's what you should be expecting is somebody is going to actually ask you to have a sleep diary where you write down maybe 8 or 10 things each morning. What time did you go to bed? How long did it take you to fall asleep? Did you have any awakenings? Stuff like that for about a week. They'll get a baseline period of time, and then they'll start changing your bedtime, start changing some of your behaviors, and then they'll start looking at your cognition. So I know it's a little bit of a long-winded explanation, but cognitive behavioral therapy is actually now been shown to be more effective than Ambien, than most of the pharmaceutical drugs out there. And here's the thing is once you get the skill set, it's yours for life, right? So you never have to really worry so much about the idea that, hey, I'm not getting, all the things that I'm kind of looking for. Let's see what our next question is. All right, Ted asks, how strong is the evidence base regarding the relationship between anticipation of the next day and percentage of high quality sleep? Oh, this is a great question. Can you get less sleep without negative consequences if you have a passion? So it's really interesting. It's all about the flavor of the anxiety. So anticipation and anxiety are very, very similar. And so it's kind of interesting. I have some patients who turn to me and they say, Dr. Breus, I'm so excited to start my next day because I've got this activity I'm doing the next morning. I can't fall asleep. I'm too excited to get there. That is very different than I get in bed and my thoughts just start going and going and going, and I get monkey mind, and then I can't fall asleep, right? So those are two very, very different things. At the end of the day, the number of times that you have an anticipation issue and not able to fall asleep is probably far less than the overall number of times where you would have ruminative thought or those negative thoughts that might be coming in. So as an overall assumption, I would say that at the end of the day, the percentage of anticipation, the higher it is and the closer it is to anxiety, the lower the quality of sleep is going to be. But don't lose your passion. I want you to be able to do passionate things every day as well as every morning to make sure that you live a joyous life. So don't stop your passions for sure. All right, now we've got another one from KA, and they write, what advice can you give to effectively overcome lifelong sleep procrastination? Ah, gotcha. I generally get about 4 hours of sleep. Oh, that's rough. Tasks rather than distractions are what overrides my all sleep desire. I'm 73. Okay. KA. Number one, the likelihood that you're honestly getting 4 hours of sleep is very, very low. And here's why. For people who get into retirement age, a lot of times they end up taking unscheduled naps during the daytime. And so when we start to look at a 24-hour cycle, what we discover is that they, in fact, have plenty of sleep, but it's taking it little bits all over the day. The key for this type of situation, as an example, if you came into my clinic or wanted to work with me, one of the first things that I would do is I would make your bedtime static and your wake up time static. And I would have no naps during the day. It takes about 28 days to reset a circadian cycle. But if you added some more structure to your evening times, I think your body would respond very, very well. The thing to remember here is waiting until you're dropping your head to fall asleep is not the way that this needs to be done. You should have a prescribed bedtime, a prescribed wake up time, and you should be as close to those times as you possibly can. I would argue that the wake up time is far more important because every morning, the time that you wake up and get sunlight hitting your eyes, it resets your circadian cycle and allows for a better day. Also, at age 74, you may be finding that you're getting up earlier and earlier because melatonin production has started to slow down, or you may not have enough melatonin at age 74. I'm 55, and I've started to notice that my melatonin production is beginning to slow down, so I might be considering using melatonin in the future. So you have a slightly complicated issue. Again, not trying to provide medicine over the internet, but if you were to come into my clinic or something along those lines, I think one of the first things I would do would be structure your day a little bit differently and also make sure that your magnesium, iron, and melatonin are all in where they should be. Okay, you said that you don't take naps. That's amazing if that you don't take naps. If you don't, then the other thing that I would consider doing is maybe doing a sleep study, because it's very, very rare for us to find anyone who is what we call a short sleeper. So they're out there. Don't get me wrong, and maybe you are one, but genetically speaking, very, very few people can survive off of 4 hours of sleep and have any level of functionality. So you might be a genetic anomaly. That's possible. And the other question I guess I would have is, do you care? Like, are you good? If you wake up at 74 and you're only getting 4 hours of sleep a night, are you productive? Do you feel good? Do you feel healthy during the day? Because if you do, maybe it's okay. All right. Good follow-up there. Let me try to get a hold of my next question. SF says, I wake up before the sun rises. Since you recommend when waking up to take 15 deep breaths, 15 ounces of water, and 15 minutes of sunshine, since the sun isn't out, can I substitute with red light therapy? Such a great question. So the answer is almost. You would want to actually substitute with blue light therapy because what we're trying to do is we're trying to turn off the melatonin faucet in the morning by getting sunlight. Red light therapy is not going to be nearly as effective in doing something like that. That's why we want to get the sunshine. The good news is that there actually are devices that you can buy on Amazon for like $100. There's one called the Go Light, Golite. I think it's made by Philips, and it's great. I actually have one. I keep it in my travel case because when I travel to Europe, I use the sunshine to reset my clock. And so if you're looking for sunshine early in the morning and the sun just doesn't happen to be out yet, I would say that that's probably a good thing to consider is maybe looking at the bright light therapy. And again, very easy to manage. 10 minutes in the morning. And by the way, you don't have to look at it like right at your eyeballs. What I have people do is I have them put it down and maybe they're having their breakfast. Or if you're getting ready in the morning, brushing your teeth, putting makeup on, those types of things, that's kind of when I would use it. Kim asks an interesting question. She says, hi, doctor, any tips for children with ADHD? Wow. I mean, how long do we have, right? I mean, right. This is a big issue. And so, but let's break this down a little bit. ADD and ADHD, especially when we're talking in kids or adults, actually, has got a lot of sleep-related issues surrounding it. One is if you're taking medication, the timing of this medication and the effectiveness or how long the medication is working for you turns out to be a really big deal, right? So some people will have, we can use Adderall as an example of one of the medications that it's often used for ADD and ADHD. There's an IR, which is an immediate release, and then there's an XR, which is an extended release. And so as an example, one of the things we really try to avoid is having Adderall XR, that extended release, taken as the second dose, because it really eats into the ability of the person to fall asleep at night. That can be very difficult as well. So looking at the type of medication and when the medication is taken is always a good idea because it can be important in this type of situation. Now, the second thing that I think is relatively important in this whole genre is the idea of keeping a schedule. So when you look at people with ADD and ADHD, a lot of times what they've told me, at least historically in the past, is I get in bed and I fall asleep for an hour, hour and a half, then I wake up and I can't go back to sleep, or I can't fall asleep because my mind is racing and things of that nature. So if mind racing is your problem and every time you get in bed, you don't fall asleep for hours, well, my first question is, why are you getting in bed so early? The second thing I would say is it's probably a reasonable idea to look at something called your chronotype. So a chronotype, for folks out there who may not know, is an internal genetic sleep schedule that we all have that changes throughout our lifetime, but is pretty set between the ages of 20 and about 50. But let's say that you're an adult with ADD or ADHD and it's very difficult for you to sleep. You might be a night owl, genetically speaking, and forcing yourself to go to bed early is not going to do anything but basically make you angry. So understanding what your chronotype is and being able to look at that as part of your bedtime turns out to be a really smart thing to consider doing, because it can give you a lot of good information about yourself and be able to kind of put you in a zone that allows you to sleep a whole lot better. I think the final thing that I think we really want to talk about is, you've got ADD, ADHD. It's difficult to settle down and be able to fall asleep. And so for a lot of these folks, some type of meditation, prayer, something, you need runway to land the plane. So oftentimes what I'm talking about with a lot of my ADD and ADHD folks is, the idea of meditation, relaxation, what can they do before bed that would make it so that they could feel comfortable enough to fall asleep. With ADD and ADHD in particular, my favorite nighttime technique is called progressive muscle relaxation. So this is a tensing and relaxing of the muscles, and you start at the top of your head and you go all the way down to the tip of your toes. So you like scrunch your face, you close your eyes. There's a script, and there's many progressive muscle relaxation audio files that are available out there on iTunes and all these other places. They're all roughly the same, but if you can find one, they're great for ADD kids because number one, they're following a very specific direction, but they're being able to differentiate between physical tension and then physical release. And that's one of the things that they seem to have a hard time doing. Jenna asks, I had 6 hours, but I woke up with really tired eyes. Does having allergies affect the quality of your sleep? Oh, yes, it does. And I am one to vouch for that one. I never had allergies as a young man or even a young boy, but in my probably late 40s, early 50s, I became allergic to something, maybe dust or pet dander or something along those lines. And one of the things I can tell you is congestion leads to snoring, which leads to disrupted sleep. So when you're looking at allergies, sometimes it's not just the swollen eyes, but it's the congested nose. And that's where it gets rough for a lot of people out there for sure. And so as soon as the congestion hits, what ends up happening is your mouth drops open because you can't breathe through your nose. Remember, nasal breathing is what we want. So your nose was meant for breathing, your mouth was meant for eating, not for breathing, right? Because what happens is when you're breathing through your mouth, it's all unfiltered air. Remember, inside your nose, you have these little hair called cilia, and they capture all of the particulates, the dust, the dander, all those things from getting into your lungs and you having that allergic reaction. So number one, if you can, keep your mouth closed when you sleep, which kind of brings up the idea of mouth taping. A lot of people have asked me over the years about mouth taping, and especially people who have some level of congestion or allergies. So I want to be very clear about this. You need to be screened for sleep apnea before you decide to tape your mouth. Because if you have a mild case of sleep apnea and you tape your mouth, you could actually make that potentially worse. So I tell everybody, swing on over to sleepdoctor.com. We have actually a take home, we deliver a test to your house where you can figure out if you got sleep apnea or not. And then if you don't have sleep apnea, absolutely figure out mouth taping. To be clear, it's not a horizontal piece of tape. It's a vertical piece of tape, and it's a specialized piece of tape. It's not Scotch tape. It's not masking tape. It's not duct tape. It's not electrical tape. It's called micropore tape or skin tape. You can buy it in any drugstore. They have it in the first aid section, and it's made for, when you take bandages on the skin so it doesn't peel the skin off. It's a small piece that goes from here to here. That's it. That's all that mouth taping really is. But for people with allergies, it can, in fact, be quite helpful. Another big thing that I like to do with allergies, especially if it's kind of tough to control, maybe you've tried Flonase and Nasacort or saline sprays. There is something called a mute, M-U-T-E, like hit the mute button. And it's an internal nasal dilator that goes up inside the nostrils. And these two little plastic rings. I know this sounds crazy, right? Like I'm telling you to put stuff up your nose. But to be clear, what it does is it physically moves the congestion away and allows for better airflow. So that's another option that could be incredibly helpful for people as well. But to be fair, allergies are a tough one. Now, the good news is we're in the wintertime, so it's not too bad just yet. But if you are experiencing some allergies, my guess is that you probably turn the heat on, and you may have dried out the environment. So do yourself a favor, get a dehumidifier and put a little bit more moisture in the air. That can always be helpful for people as well. Also, do yourself a favor, and this isn't a thing about anybody not being clean, but you sleep in a bedroom for anywhere from 6 to 9 hours, and you're breathing that air in all night long. It's literally the only room that you sit in for that length of period of time. Do yourself a favor, get an air filter. Get one that just does your bedroom. Get a good HEPA filter that gets all that gunk out of the air. Do yourself a favor also, clean your sheets, right? We wash our sheets once a week. It's a good idea to do so. We have 2 dogs that have a tendency to want to sleep in our bed. So even more reason, if you've got dogs or pets around, that you would want to keep that bedroom area, as allergen free as possible. So that way you can get yourself a pretty decent night's sleep. All right. Max Moore says, as a bear chronotype, thanks for taking the chrono quiz, Max. Appreciate you, brother. What time do you suggest I start my evening routine because I find it hard and my sleep is messed up while being age 24? Okay, got it. So as a bear chronotype, one of the things that we've learned is that there are early bears and there are late bears. So not quite a wolf and not quite a lion. We do see that within the bear category, people seem to like to either get up early or stay up late. That being said, when do you start your evening routine? What I like to do is what I call a power down hour. So based on your bearishness, right? I believe your bedtime is around 10:30, 11 o'clock. What I would do is 1 hour before, set an alarm to remind you to go to bed, and then take that last hour and chop it up into 3 20-minute segments. So 20 minutes for stuff you just got to do, otherwise it's going to drive you crazy before the next day. 20 minutes for hygiene, and 20 minutes for some form of meditation, relaxation, prayer, whatever you need to do to land the plane, right? Now, I also want to give you a piece of advice, even though, Max, this may or may not be applicable to you, but for folks out there who wear makeup, if you do wear makeup, it's actually better to remove it much earlier in the evening. Let me explain why. If you wait until 10:30 at night, like a half an hour before you go to sleep, here's what ends up happening is, in order to get the makeup off, you really have to get close to the mirror with a lot of bright lights. So you're kind of bathing yourself in this blue light. I would much rather, after dinner or whenever you're ready, 7 o'clock-ish, to get ready for bed, right? Like put on your bed clothes, take off all that stuff, because what ends up happening then is you're prepared, and then you can get into your bed, and it's a signal also to your body that it's time for bed as well. So I think a couple of things like that could be valuable for you. But if I would say, do yourself a favor and try the power down hour. And again, for folks out there who are not familiar with what a bear is, remember, I'm the chronotype guy, if you will. And I really believe strongly, and I followed this myself, that our genetic internal chronotype, that's our internal biological clock that tells us when to sleep and when to wake up. It's really something that if you haven't figured out how yours is working, I have a super simple quiz. Go to chronoquiz.com or swing on over to thesleepdoctor.com. And the quiz is right there on the front. You can click on that there. And you will learn a whole heck of a lot about what's kind of going on with you. Let's see if we've got some more questions here. One thing I always like to talk a little bit about is melatonin. It's something that I always get a question on. While I don't have a particular question on it at this particular moment, I would like to maybe do a little quick double tap on what is melatonin, how does it work, is it a good idea, is it a bad idea, that kind of thing. So many people may or may not understand my ideas surrounding supplementation. And I want to be clear about stuff. If you've had an opportunity to subscribe down below, I have a couple of videos on melatonin. I have a few videos on supplementation, but just hear me out. I want to see what the body looks like when it's got all the deficiencies out of the way and see how did that body operate. So when somebody shows up at my doorstep and they say, hey, doc, how much melatonin should I take? I tell them that I don't think that's the right question to ask. The first thing I say is, can you go to your doctor and can you get some blood work done? And I want you to look at these 4 things. I want you to look at iron, I want you to look at magnesium, I want you to look at vitamin D and melatonin. Now, I'll be fair, most doctors don't know how to run a melatonin screen. So melatonin is usually a saliva assay. You have to take 4 samples, 1 in the morning, 1 at night, 1 the next morning, 1 the next night. Then you have to freeze them and send them in. It's a bit of a hassle, but it can be very, very rewarding. So what I first do is, are you deficient in D, magnesium, or iron? Let's fix that first. Once we fix that, then we give you a couple of weeks for your body to just adjust to now having the appropriate levels of all those things. And we see how it does. A lot of times, to be honest with you, things get better right there. But let's say that you had no deficiencies or your deficiencies have been fixed up. Is it time for melatonin or ashwagandha or valerian root? Like what do I do, Michael? And so first of all, if you're going to add a supplement, you should add a supplement that's specific to the symptomatology that you're noticing. So as an example, you probably wouldn't use melatonin if you're having a hard time falling asleep. You would be more interested in melatonin if you're sleeping at the wrong times, right? So you're not falling asleep until 2 o'clock and then you're sleeping until 12 the next day. That's a melatonin type of problem for sure. But if you're having a hard time falling asleep in general, melatonin may or may not be helpful for you. There's at least one study to show that in elderly adults, it seems to help. But remember, most elderly have got a deficiency in melatonin. I like valerian much better in that situation because it's got much more data behind it and it can help you fall asleep fairly quickly. But when we double tap again down on melatonin, if that were the appropriate thing to take, let's learn a little bit more about what melatonin is and how it works. So remember, everyone, melatonin is a hormone, okay? And it's available everywhere. Now, you don't see any other hormones available everywhere, right? Like you can't just walk down to the Walgreens and pick up some testosterone or a little bit of estrogen, right? And there's a reason for that. Hormones do many things across the body, and they have effects on all kinds of different systems. Melatonin is one of those things. While we think of it as the sleep hormone, many people don't realize this, but melatonin is manufactured in the pineal gland, but 85% of it is manufactured in your gut, right? It's an amazing antioxidant that's good for all kinds of other things. And so when we're really thinking about melatonin, you have to understand this is a substance that can affect your entire body, not just your sleep system. Number 2, aside from the fact that it's a hormone, number 2, most people don't know this, but it's by prescription only almost everywhere else except for the United States. I can't tell you the number of patients that I've had in Europe who every time they come over, they're buying bottles of melatonin because it's not available over there. So you got to think through that as an idea. Like, why have entire countries decided that this is not something that should be freely available? Number 3, at high dosages, melatonin is a contraceptive. Yes, you heard me say that correctly. At high dosages, melatonin is birth control. It kind of makes sense, right? It probably moves the menstrual cycle in certain ways, shapes, and forms. But here's the problem is I talk to people all the time and they say, oh, my pediatrician told me if my kid isn't sleeping to just give them some melatonin. I want to be really clear about this. I think that is one of the stupidest worst ideas I've ever heard in my life. I can't imagine why I would need to institute a hormone in a young female developing body when there wasn't a really important reason to do so, right? 95%, actually 99% of children have 4 times the amount of melatonin that they need. So all you're doing is adding a hormone which only can have disruptive effects. So melatonin is not for use in kids. Nobody under the age of 18, unless you have a melatonin deficiency, should really be actually using melatonin. Now, there is one group of kids that should, and this is a unique special population. Sorry, I had to take a quick drink. These are children and young adults who are on the autism spectrum. We have discovered that they seem to do well with 5, 7, sometimes even 10 milligrams of melatonin. That is considered a humongous dose, all right? So that's another big problem out there is 95% of the melatonin that's available is actually available in an overdosage format. The correct dose, based on the data out of MIT, shows that in order to reach plasma concentration levels for melatonin to actually kick into gear, you need somewhere between 0.5 and 1.5 milligrams. That's it, folks. I'll be honest with you. Every time I go to the local drugstore, I can't find it in anything less than 3 milligram gummies. I find 3s, 5, 10 milligram gummies. And when somebody comes up to me and say, oh, Dr. Breus, melatonin doesn't work for me. Every time I take it, I have a nightmare. That is the first sign of overdosage, is nightmare and too vivid a dream. So you need to really be thoughtful when you're doing this. Another big problem that a lot of people don't understand is melatonin can have an effect on all the other medication that you're taking. Many people don't know melatonin affects diabetes medication. It affects all antidepressant medication and even affects some cardiac medication. So before you run out and grab melatonin, you really need to understand this is a hormone that affects multiple systems. There's an appropriate dose, and you need to really be sitting down with somebody who knows and understands that. Here's the even bigger problem. Almost no doctors out there study melatonin. So you are a little bit on your own unless you go to a sleep specialist, kind of like me. Now, the good news is that there are sleep specialists at most major hospitals here in the United States. Or you can, obviously look up sleep specialists in your local area, but you really don't want to just start getting on the melatonin bandwagon because that can be very difficult. Now, I did get a question from Marcia, who says, you recommend between 0.5 and 1.5 milligrams of melatonin, yet all the tablets I have seen come in 3 milligrams at the lowest dose. And these tablets are not amenable to cutting or getting 1 to 1.5. So I've been taking 3 milligrams. Is that higher dose detrimental? If so, how do you recommend I get a lower dose? Great question. So number one, almost every form of melatonin seems to come in a gummy these days. So take a 3 milligram gummy and just cut it in half. It's very easy to do. You should be reasonably okay. There actually are some melatonin brands. So if you type in 0.5 milligrams melatonin, they will actually come up with the brands that actually make this at the appropriate dosage. Oh, that reminds me that I forgot to mention one thing is the form in which the melatonin takes can actually change its level of effectiveness. So as an example, if you have a pill form of your melatonin and you take it, it's going to take 90 minutes for it to go all the way down and then come all the way back up and have an effect in your brain. But if you take it on a tincture, right, which is a dropper, put it underneath your tongue, and that's when you've got some really interesting stuff going on, and we can get it up and in your head very, very quickly. Now, don't forget, we've got a lot of videos that are going to be coming out about dreams coming up soon. That's been a new area of study for me. By the way, I'm letting people know I'm currently taking a dream course to learn more about how to utilize dreams in a therapeutic environment. This has been a lot of fun, really interesting for me. I'm still in the early parts of the course, but I am going to start making some videos with all of the new things that I'm learning, so that way I can really help people understand a little bit more about dreams and dreaming. Speaking of which, Joanna asks me an interesting question here. She said, my meds cause extreme dreaming. It seems I dream all night. Can you talk about these dreaming patterns, and is it damaging to sleep? Great question. Oh, I forgot 2 more little points about melatonin really quickly. Number one, a lot of people ask, if I take melatonin as an overdosage for extended periods of time, will my body stop making melatonin? The answer is no. There have been 2 studies that definitively say that if you're taking it It's going to cause a lot of really vivid dreams, and it might have effects on other things, but it's not going to stop your body from producing melatonin in the future. A hormone that does do that is testosterone. So most men know that if you start taking testosterone, your body slams down and basically doesn't make testosterone anymore, and then you're kind of stuck on that testosterone forever. That is not the case with melatonin. Okay, back to Joanna with her meds causing extreme dreaming. Can you talk about these dreaming patterns, and is it damaging to sleep? So this becomes a very specific question based on the type of medication that you're on, the reasons that you're on that medication, and the content of the dreams itself. And so here's the one of the big issues in this type of situation. Historically, I would have turned to you and said, maybe talk to your doctor about substituting that medication for something that doesn't cause that, so you can get some relief that way. But being in this dream course, I will honestly tell you that that's probably not my recommendation any longer. What I think would probably make a lot of sense is if this is a medication that is required for you to maintain health for whatever your other medical issue is, then what would be really interesting would be to do a dream therapy session or two where you actually take that dream apart, figure out exactly what it means for you, and then be able to incorporate that so that it doesn't have nearly as much difficulty as you were having before. One of the things that I've learned, which is really amazing, is any dream therapy that you try, anyone will actually reduce the frequency and the intensity of these dreams. It can be something as simple as journaling your entire nightmare out. There's something called IRT, which is image rehearsal therapy. So what ends up happening is you write out the dream, all the bad parts, and at the very end, you go from being the victim to the victor, right? So instead of somebody trying to kill you, you kill the somebody, and then you read the new ending multiple times before you go to sleep. And within 7 to 10 days, you start to change the dream. You actually can manipulate the ending of the dream. It's quite fascinating, this area of study. I've learned so much in just the 3 or 4 months that I've been doing this. And again, I'm going to be doing more information about dreams and dreaming as I learn more, and as people can learn, tell me more about their dreams as well. Now, Darlene asked an interesting question. She says, I'm writing from Canada where THC is legal. You go, girl. Is there any scholarly studies to show positive effect of THC on restless leg syndrome? I've suffered from RLS since pregnancy 30 years ago. I found that 5 milligrams works well before bed. I love your thinking here. So Darlene, number one, I'm very pro cannabis. I live here in Los Angeles, California. This is both a medicinal and recreational state. I've been to Canada many, many times, actually spoken up there to a large group of physicians who use cannabis as a very regular part of their overall diagnostic treatment modalities. And so there's a few things to understand about cannabis itself. So when you look at cannabis, you want to break it down into its constituents. So there's THC, that's the psychoactive property. That's the thing that makes you feel funky and high. Then there's something called CBD. There's something called CBN. There's something called CBG. There's a whole host of other things. Then there are these things called terpenes that come into the plant as well. So there's many different constituents that bring about the overall effect. Okay, so that's number one. Number two, what do we know about sleep and marijuana use prior to sleep? So the higher the THC content, the higher your heart rate and the lower amount of REM sleep. We know for a fact that high levels of THC will almost obliterate REM sleep and thereby taking out dreaming. So a lot of people, as an example, who've had nightmares find themselves smoking weed before bed, and then they stop having the nightmares, or at least they don't remember them because they've squelched the amount of REM sleep that they've had. That's not necessarily the best idea. So looking at it more specifically, what we do know is there's a tremendous amount of data now on CBN, as in nighttime. CBN is oxidized THC, and it seems to have a very mild calming effect on the body to allow it to fall asleep easily. I want to be very, very clear. There is almost no evidence that CBD is actually helping with sleep. There's at least one study that I've seen by Dr. Jeffrey Chen. That's the only one that I actually believe. But out there, here's what we know CBD really does. CBD can help lower anxiety, and CBD can help lower inflammation or pain. If you have a sleep problem, due to due to anxiety or due to pain, CBD may make a lot of sense, because if it stops either one of those, the natural sleep process can come over. But it's only CBN that we've seen data on out of Israel to show us that it actually affects sleep. And so when you're looking at your question about THC and RLS, my thought is you might want to be thinking about is what are the other constituents in there that can be helpful for that. THC for RLS, I haven't seen a study on it, but I will be honest with you, it makes sense. I mean, in our most extreme RLS cases, people are using opioids for that. I'd much rather have somebody on cannabis than an opioid. And also, by the way, it's not uncommon to see RLS develop after pregnancy. Although I will tell you that there is some data now to show that that could be an iron deficiency. So one of the things I would recommend that you do is talk with your doctor about getting a blood test for something called ferritin, Ferritin, ferritin. This is a type of iron within your bloodstream that can be tested very easily. And if your ferritin is below 60, even though that's in the normal range, we do see very significant restless leg symptomatology. And so in those cases, something like an iron sulfate that you can get at the drugstore for $5 can sometimes be a really big relief for many people with RLS. Again, THC is going to increase your heart rate and lower REM. So I would be very careful about using too much THC and lean more towards the CBN side of things. But again, I'm not aware of anything specific to RLS and THC, although it wouldn't surprise me if somebody hasn't tried like a Dronabinol, which is the pill form of THC, and that as well. Great questions so far. Wow. All right, let's see. Let's see. A few more. Okay, we're going to have to field about 4 more questions, and then I'm going to have to start to wind down because I've been going at it for a little while here. Jenna says, I'm not able to nap because I'm restless midday. What is a good strategy to get sleepy for a nap? Jenna, I've got good news for you. You don't actually have to fall asleep to get the benefit from a nap. So there's been some interesting data out of NASA looking at the length of naps, as well as interesting data on something called non-sleep deep rest. So non-sleep deep rest is basically lying in a bedroom where it's dark and it's quiet and just relaxing. It's not as rejuvenative as sleep, but if you did that for an hour, that's worth about 20 minutes of sleep. So what I tell people all the time is just take a break. Just take a 15 or 20-minute break during the day. You don't have to fall asleep. Just lie down, maybe have an eye mask. Make sure you're safe. That's one of the biggest issues with napping, especially during the daytime, is tell somebody that you're going for a nap and make sure you're napping in a safe environment. But you might be surprised at just relaxing how useful something like that can be for you. You don't necessarily have to fall asleep. Let's see. Have we got anybody else? Any more questions? Greg. So question is, have you seen liposomal melatonin in drops? I was prescribed that. I have actually, and that appears to be a great way for absorption. One of the problems with synthetic melatonin, at least historically, is that some people wouldn't necessarily absorb it as well. I believe the liposomal preparation helps with absorption. And so if that's something that you've tried, I'd love to hear more about it. I don't have any patients who have tried it, but I have seen it advertised and things like that. Okay, so we've got Jane. For a 25-year-old that is a high-functioning autism patient, did you say 5 milligrams of melatonin is okay? Sometimes she takes 10-milligram gummies that we get at Costco. I would say, so number one, I'm not your doctor, so I can't give you medical advice. I can tell you that the range that we see people with autism taking melatonin is usually between 5 and 10 milligrams. So if you were asking that question in my clinic, you're well within the range. And if it's working, I would say you're probably just fine. But again, I can't dispense advice over the internet because I don't know much about your case. I don't know if your daughter's even appropriate for having this based on her other situations. So talk with your doctor. They should be able to give you some advice. And there should be some articles. I believe I've got an article on the Sleep Doctor that looks at sleep and autism in particular that might be able to give you some more insight as well. All right. We've got a few. Okay, we got one more question here from Greg saying, have you seen restless leg syndrome develop due to gut issues like SIBO or Candida? Wow. That is a very interesting question. So the short answer is no, I have not. But what I can tell you is that the microbiome does have a circadian rhythm to it, and the microbiome absolutely affects your ability to sleep. So one of the things that when we're thinking about things like candida and SIBO, is those are gut phenomena that have a tendency to occur and can be disruptive to sleep. Whether or not it leads to the idea of the symptoms associated with restless legs, I've got to be honest, I haven't seen any studies. There might be out there, but I haven't seen any studies to say that as of yet. And my final question is going to be from Trudy. And she said, Trudy says, do you need to see the sun when outside in the morning? What if houses are in the way? Great question, Trudy. So number one, it's better to be outside than it is to be inside because most of the windows have got some kind of a film or tint on them, which takes out some of those great blue light that you're going to be looking for. So the fact that you're just outside is plenty. That's all we need. And go for a nice walk. If you have an animal, take your dog for a walk or walk down to the mailbox or walk a few neighbors' houses over and say hello. It's great to get a little bit of sunshine, a little bit of fresh air every single morning. Certainly going to be good for your sleep. So to be honest with you guys, this is the first of what I hope to be is a monthly schedule of answering your questions. I'm very excited to have had the opportunity to hang out with you all. It looks like we've been talking for about an hour. I want to thank everyone for their support. I mean, I can't do this without you guys, right? Like, if you're a singer and you don't have an audience, you're just a guy singing a song, right? But if you have an audience, you've got people that you can connect with. And that's really what my goal here is today, is to connect with all of you, to help educate you on sleep and to get you guys and gals all sleeping better, right? Because at the end of the day, it's weird out there and there's so much going on and it's so difficult for people to really get the sleep that they're looking for. And so hopefully I've been able to answer some of your questions. We'd love it if you can get some more questions to us. Do me a favor, if you can, swing by thesleepdoctor.com and check out our site. Please do subscribe below because the more subscriptions we get, the more I can come into this and have some ideas of what to talk about. Of course, if you didn't get a chance to, please, please, please take the chrono quiz. It's fun. It takes about 3 minutes and you learn what your spirit sleep animal is. That's what people seem to call them. I just call them sleep animals. Also, we have something that's kind of fun where if you have a specific question, kind of like today, and you want to get to it before I come on next month, if you send an email to ask@thesleepdoctor.com, we do Ask Me Anythings, and then we send them out as videos. So you might get your question answered by me that way. So once again, I just want to say thank you, thank you, thank you for all of the support, for all of the years. This has been amazing. I can't believe we crossed 100,000 subscribers. So thanks to all of you out there, because I clearly couldn't do it without you. This has been super fun, something that I've been looking forward to doing for quite a while. So that's it. I'm signing off now. This is Dr. Michael Breus, the Sleep Doctor, wishing all of you sweet dreams.